Now, all the gases from the vaporizers are delivered to the patient with the help of a breathing circuit. So guys, imagine in 16th October 1846, we were the audience sitting in the theatre. 16th October 1846, remember what happened? There was a guy who came in the theatre. He did not perform his acting. What did he perform? He performed the first public demonstration of ether anesthesia. Who performed it? W.T.G. Morton. So imagine we were the audience. We were seeing what is Morton giving. So Morton told, I will give ether to the patient. But how do you think Morton has given ether to the patient? How ether was given to the patient? This anesthesia machine and breathing circuits came after 1917. Before 1917, how was ether delivered to the patient? There was no machine, no breathing circuit. How it was delivered? It was delivered by open method or open circuit. What is open method and open circuit? Morton used to carry a mask with him. It was called as Schimmelbusch mask. Which was called as what mask, guys? Schimmelbusch mask. Schimmelbusch mask. Morton used to carry this Schimmelbusch mask right with him. He used to keep this mask in front of the patient's face. He used to pour some drops of ether and tell the patient, please inhale that. Patient was inhaling and becoming unconscious. But are we using this method of delivering anesthesia by Schimmelbusch mask was called as open method. Are we going for open circuit nowadays? That's my question. Yes or no? Obviously the answer is no. Why it is a no? Why open method is not used nowadays? First of all, guys, you were not able to know what concentration of ether you are giving to the patient. You are just giving ether to the patient randomly and telling the patient to inhale. You never know what concentration the patient is receiving ether. Apart from that, what is the second disadvantage of using this? As you are pouring the drops of ether on the patient's mask and you are telling the patient to inhale, sometimes you are nearby that ether drops. Sometimes you might inhale the ether drops and become drowsy. Sometimes there might be some curious surgeons. They will be like, what is happening? They come nearby the patient and what will happen? They become drowsy. Under drowsiness, is the surgery possible? No. But in some Bollywood movies or Hollywood or Tollywood movies or any wood, guys, be it any wood, in the movies what they show, it is possible. You might have seen surgeon under the influence performing surgery, but it should never be done, guys. We have seen in the movies, we are not mentioning the movie names over here. We know the movies and all. Yes or no? Come on, guys, you are aware about the movie which I am talking about, where the surgeon drinks some alcohol and then he performs the surgery, right? A love story movie. So anyways, guys, it should not be done. Open method is not done. Why? Because the surgeon was becoming drowsy, the anesthetist was becoming drowsy. Basically, it was causing operation theatre pollution. Hence, it is not used. Nowadays, we are going for semi-closed and closed breathing circuits. Nowadays, we are going for what, guys? Semi-closed and closed breathing circuits. We are going for semi-closed and closed breathing circuits, right? What is the difference between semi-closed and closed breathing circuit? In semi, remember all those piped, you remember we are talking about breathing circuit, guys. You remember in the anesthesia machine, I showed you a green pipe and I made you write there a breathing circuit. We are talking about those only. There are two kinds of breathing circuit. There are two kinds of pipes. One is the semi-closed, other is the closed. What does semi-closed means? Semi-closed and closed. What is the difference? In semi-closed, there is an expiratory valve. In semi-closed, there is what valve? Expiratory valve. Whereas in closed breathing circuit, there is no expiratory valve. If there is no expiratory valve, where are the gases going in the closed breathing circuit? All the gases which are exhaled by the patient. First of all, guys, what is the role of expiratory valve? What is the role of expiratory valve in semi-closed circuit? Remember guys, respiration is a two-way process, not one way. Two-way meaning what? During anesthesia, what we give to the patient? During anesthesia, we are giving oxygen to the patient, we give nitrous to the patient, we give halothane to the patient. I'm just giving one example. It doesn't mean that halothane should be used in all cases. I'm just giving one example. Okay? So oxygen, nitrous and halothane. We are giving this, yani patient is inhaling this. After some time, patient will also exhale something. Respiration is a two-way process. Where the patient is inhaling oxygen, nitrous and halothane. What will the patient exhale after some time? The patient will exhale carbon dioxide. With carbon dioxide, he might exhale some of the halothane or some nitrous, but mainly he will exhale what? Carbon dioxide. So why is expiratory valve given? As the patient is exhaling that carbon dioxide, that exhaled carbon dioxide should go out from the expiratory valve. That exhaled carbon dioxide should go out from the expiratory valve, right? So the main role of expiratory valve is what? It allows the carbon dioxide to go outside the atmosphere. Okay? Now guys, go outside in the atmosphere. Now, if there is no expiratory valve, what will happen? As the patient exhales carbon dioxide, where will the carbon dioxide go? Into the breathing circuit, and from there, the patient will re-inhale his own carbon dioxide. If there is no expiratory valve, the patient will re-inhale, and due to re-inhalation of carbon dioxide, what will happen? He will develop hypercarbia, he will develop hypoxia, and he will develop respiratory acidosis. So remember guys, in Mapleson semi-closed circuit, there is an expiratory valve. If you are having an expiratory valve, the carbon dioxide goes off. Whereas, there is one more circuit called as closed breathing circuit. In closed breathing circuit, there is no expiratory valve. There is no expiratory valve. Now guys, if there is no expiratory valve, what will happen? Patient will re-inhale his own carbon dioxide and patient will develop hypoxia and hypercarbia, leading to acidosis, which can cause respiratory discomfort, respiratory arrest and cardiac arrest. Then why are we using? Nowadays, most commonly used breathing circuit is closed breathing circuit only. Why are we using this closed circuit when there is no expiratory valve to let out carbon dioxide? Remember, in closed breathing circuit, there is no expiratory valve, but in closed circuit, in place of expiratory valve, we are having an absorbing chamber. If you recollect in your memory, I made you mark the last point in the anesthesia machine, the absorbing chamber, carbon dioxide absorbing chamber, that is soda lime or Baralyme. So in closed breathing circuit, we don't have expiratory valve, we have a chamber that absorbs carbon dioxide. The material inside the chamber is either soda lime or either Baralyme. The function is what? To absorb the carbon dioxide. To absorb the carbon dioxide. So in closed circuit, there is no expiratory valve, but there is an absorber. But we have absorber. What is the absorber in closed circuit? It is the soda lime or Baralyme, right? So anyways guys, we are talking about what? We are talking about the anesthesia circuits. Semi-closed and closed breathing circuits. Okay? Semi-closed and closed breathing circuits. In semi-closed, they are Mapleson. Remember guys, all semi-closed circuit. All these semi-closed circuit were introduced by a guy called as Mapleson. They were introduced by a guy called as Mapleson. Hence, all these circuits are called as Mapleson circuit. All these circuits are called as Mapleson circuit. We are having Mapleson A circuit. We are having Mapleson B circuit, C, D, E and F circuit. C, D, E and F circuit. So Mapleson circuit. Mapleson's breathing circuits we have discussed. A till F is there, right? Mapleson A, B, C, D, E, F. 6 circuits are there. B and C we are not using. Mapleson B and Mapleson C we are not using. We are using A, D, E and F. Mapleson A, D, E and F. Starting with Mapleson A circuit, guys. Mapleson A circuit. What we need to remember about this Mapleson A circuit? What we need to remember about this Mapleson A circuit? Now everyone look over here. Mapleson A. We have to discuss Mapleson A circuit. Then we have to discuss Mapleson D circuit. Then E. Last F. Mapleson A circuit. Mapleson A circuit was introduced in the time where there was no ventilators. Basically, I'll give you a rough idea. 100 years back, now it is 2023, 1922 or 23, these circuits were introduced. Again, there is no significance of the date, just for your remembrance I am telling. Imagine in 1922 or 1923, this Mapleson circuit were introduced 100 years back. Were there any ventilators at that time? There were no ventilators 100 years back. So how you used to ventilate the patient? If there is no ventilator, how will you ventilate the patient? You ventilate the patient manually. You ventilate the patient manually with what? With bag ventilation. Yani you take a bag and you push in the air through the bag to the patient, right? So at that time, the circuit that was introduced when there was only manual or spontaneous ventilation was Mapleson A circuit. Hence, Mapleson A circuit is regarded as circuit of choice for spontaneous or manual ventilation. Spontaneous or manual ventilation. Mapleson A is a circuit of choice for spontaneous or manual ventilation. This Mapleson A circuit was having some problems, guys. After being introduced, it was having some problems, and those problems were rectified by a guy called as Magdal. Those problems were rectified by a guy called as Magdal. Mapleson A will start from, it is also called as Magdal circuit, okay? So, Mapleson A circuit is also called as Magdal circuit. Why? Because it was modified by a guy called as Ivan Magdal, right? So, there was some problem in this circuit which was rectified by Magdal, hence it is also called as Magdal's breathing circuit, okay? Next, coming to Mapleson D circuit. B and C we are not using. Mapleson D circuit. Mapleson D circuit was introduced some 20 years back. Now are we having ventilators? Yes sir, we are having adequate ventilators in our hospital. So now the circuit that we are commonly using is Mapleson D circuit. Mapleson D circuit is a circuit of choice for what ventilation, guys? The ventilation given through ventilator is called control. So it is a circuit of choice for controlled ventilation. Mapleson D circuit is a circuit of choice for controlled ventilation. But again, this circuit was also having some problems which were modified by a guy called as Bain. Dr. Archie Bain. Even though R is silent, you just remember B-A-I-N, Bain. Dr. Archie Bain modified it. Hence, it is also called as Bain circuit. This Mapleson D circuit is also called as what circuit? Bain's circuit. The length of this Bain circuit is 1.8 meters. It is the most lengthy circuit, guys. The length of this circuit is 1.8 meters. Then there is Mapleson E circuit. Mapleson E circuit. Mapleson E circuit is the only circuit without a bag. You can see all the circuits are having bag. Mapleson E circuit doesn't have bag. Mapleson E circuit was first introduced for pediatric cases, but is it a complete or incomplete, guys? It's an incomplete circuit. So it is not used nowadays, right? Mapleson E was introduced for pediatric cases, but are we using them for pediatric? No sir, we are not using them for any pediatric cases, right? Mapleson E was introduced for pediatric cases. This Mapleson E is also called as ISTPs. Is it a complete or incomplete circuit? It is an incomplete breathing circuit. It is an incomplete circuit. Why it is an incomplete circuit? Why? Because it does not have bag, right? Nowadays, this ISTPs or Mapleson E circuit, it is used for weaning the patient from ventilator. When a patient is kept on ventilator, okay, we have to take a decision when to remove the ventilator from the patient. When a patient is improving in the health, we remove the ventilator. Yes or no? For weaning the patient on ventilator, first we give a trial of TPs. TPs is ISTPs, Mapleson E circuit, where we give oxygen through this circuit to the patient with a very low flow, and we will assess whether he is maintaining saturation or not. If he is maintaining saturation just on ISTPs with the oxygen, then we can remove the patients, then we can wean out the patient from ventilator. So Mapleson E circuit is nowadays used for weaning the patient from ventilator. Weaning patient from ventilator. Weaning the patient from ventilator. Next is Mapleson F circuit. Mapleson F circuit. Remember guys, Mapleson E was introduced for pediatric, but it is not used for pediatric. For pediatric cases, this E was modified by two guys. By two guys. This E was modified. What modification? The bag was added to this E and it became what? Mapleson F circuit. The bag was added to E and this E became what? Mapleson F circuit. Just look over here. To this E they added a bag and this E became what? Mapleson F circuit. Mapleson F circuit. It is, who added this bag guys? Who added this bag? Jackson and Rees modified. So Jackson and Rees modified type E circuit. Modified E circuit. Hence this type F circuit is also called as Jackson-Rees modification. This is the circuit of choice for what ventilation guys? This is the circuit of choice for pediatric cases. For pediatric cases, whether it is spontaneous or whether it is controlled ventilation. Whether it is spontaneous or controlled ventilation. So type F circuit is Jackson-Rees modification of type E circuit, and this is called as, this is regarded as a circuit of choice for spontaneous as well as controlled ventilation. In what cases? In pediatrics. So once again guys, we are discussing about semi-closed breathing circuits. Semi-closed breathing circuit, right? In the semi-closed breathing circuits, what are the breathing circuits? We have already discussed this guys. We have already discussed all these circuits and all. Okay. I told you for pediatric cases we use type E and F, but the best is what? Type F is the best circuit for pediatric cases. Okay. So anyways guys, remember type A is a circuit of choice for the MCQs in the breathing circuit is type A Mapleson is a circuit of choice for spontaneous ventilation 100 years back. Type D circuit is a circuit of choice for controlled ventilation. Type E was a ISTPs, a trial circuit which is not used just used for weaning. And type F circuit is the modification of type E, which is called as what? Jackson-Rees modification. Used for what cases? Pediatric cases, whether it's for control or for spontaneous ventilation. Spontaneous ventilation. Next, coming to the closed breathing circuit. Closed breathing circuit. Now guys, in the closed breathing circuit, I told you the difference between semi-closed and closed breathing circuit is what? In semi-closed breathing circuit, we are having an expiratory valve that allows the carbon dioxide to go off into the atmosphere. Whereas in closed breathing circuit, there is no expiratory valve. Where are the gases going guys? If there is no expiratory valve, the gases, where does it go? They go into the, all the gases, they go into the absorbing chamber. What is that absorbing chamber called as? Carbon dioxide absorber. The material that we use is what guys? Either soda lime or either Baralyme. Either soda lime or either Baralyme. So in closed breathing circuit, the heart of closed circuit is the absorbing chamber that absorbs carbon dioxide, right? So closed breathing circuit, as it is having a carbon dioxide absorber, guys, there won't be any operation theater pollution. There won't be any operation theater pollution. And the flows of the gases also will be required less. Why? Because most of the gases are also rebreathed by the patient except carbon dioxide. So the flows are also required less, right? Now, but what is the heart of closed circuit? It is the absorbing material, either soda lime or either Baralyme. Most commonly, what is this absorbing material that we use? It is the soda lime. It is the soda lime. This is the picture of soda lime in front of you guys. Right? You can see over here, one part is having different color, the other part of the soda lime canister. This is the canister, can in which the soda lime is stored. Okay? One part is having different color, other part is having different color. Why do you see different colors over here? Why? Remember guys, normally the color of soda lime is what? Pinkish white in color. It is pinkish white in color. When it gets exhausted, you will see a color change. The rule when you are using soda lime is what, guys? When you are using soda lime, the rule is 100 grams of soda lime will absorb 23 to 26 liters of CO2. 100 grams of soda lime will absorb 23 to 26 liters of carbon dioxide. Once that all 100 grams is used, the soda lime gets exhausted and you will see a color change. Why do you see a color change? Why? Because to this soda lime, an indicator dye is added that indicates the color change. To this soda lime, what is being added? An indicator dye is added. What is an indicator dye which I am talking about? It is phenolphthalein, it is ethyl violet, it is mimosa. These are the indicator dyes which are added to the soda lime, which indicates the color change when the soda lime is exhausted. So remember guys, 100 grams of soda lime will absorb how many liters? 23 to 26 liters of carbon dioxide. And when you zoom into the picture of the soda lime, you will see some granules. There have been a question on what is the size of the granule. Even though guys it is very irrelevant, but still, what is the size of soda lime granule? The size of soda lime granule is 4 to 8 mu. 4 to 8 mesh units. That is the size of soda lime granule. So anyways guys, we are talking about what? We are talking about soda lime. Soda lime. You know the function of soda lime. What is the function of soda lime? The function of soda lime is to absorb the carbon dioxide. Now what is this soda lime made up of? This soda lime is made up of CNSK. The soda lime is made up of what guys? CNSK plus some water. Okay? What is the CNSK? C stands for calcium hydroxide. 82 to 83%. We'll take 82% of soda lime is calcium hydroxide. N stands for sodium hydroxide. N stands for sodium hydroxide. S stands for silica. K stands for potassium hydroxide. 1% of soda lime is silica and potassium. How many percentage done? 82 plus 5, 87 plus 1, 88. We are left out with 12%. Rest 12% is water. Rest 12% is water. This composition is very, very important, guys. You don't have to remember this was the old composition without water. This is the composition with water. With water, what is the composition that we need to remember? Soda lime is made up of 82% of calcium hydroxide, 5% sodium, 1% silica and potassium, and 12% it is made up of water. Why? Remember guys, which is the major component of soda lime? This was an MCQ. The major component of soda lime, you can just look and tell. What is the major component, guys? The major component is calcium hydroxide, which is 82%. But what is the main component without which soda lime is totally waste? It is sodium hydroxide. The main component of soda lime is what, guys? Sodium hydroxide. Sodium hydroxide is the main component of soda lime, right? Why is silica added to soda lime? silica is added to soda lime in order to make the soda lime granules hard. In order to make the soda lime granules hard. To increase the hardness, we are adding what? We add silica. Silica is added to increase the hardness of the soda lime granule. So remember guys, once again, the composition of soda lime is what? CNSK plus some water. What is the CNSK? C stands for calcium hydroxide, N is for sodium hydroxide, S is for silica, and K is for potassium hydroxide. C is 82%, it is calcium hydroxide, 5% it is sodium, 1% it is silica and potassium, and 12% it is made up of water, right? So guys, I told you once the soda lime is exhausted, you will know that it is exhausted by looking at the color. Why? Because to the soda lime an indicator dye is added that indicates the color change. What is the indicator dye that is being added? It could be phenolphthalein, it could be Clayton, it could be ethyl violet, or it could be mimosa, right? But the rule of using soda lime is what? 100 grams of soda lime will absorb 23 to 26 liters of CO2. Size also we have already known. The size is 4 to 8 mesh units. Now imagine guys, imagine you are starting a general anesthesia case and you are least bothered to check the soda lime. You are least bothered to check the color of the soda lime. Imagine the soda lime canister is being, like it is being covered with some cover. You did not check it. You started the case and imagine you are using an exhausted soda lime. Exhausted soda lime. When you use an exhausted soda lime and give general anesthesia, what will happen? What will happen? What will happen? We are giving oxygen, nitrous and halothane to the patient. Patient is inhaling that. After some time, patient exhales carbon dioxide. That carbon dioxide, as we are using closed circuit, that carbon dioxide goes into the absorbing chamber called as soda lime. Knocks the door of the soda lime. But soda lime is telling that, sorry dude, I am totally exhausted, I can't take you. So what will happen? That carbon dioxide goes into the that carbon dioxide goes to the inspiratory limb of the breathing circuit, and then again what will happen? The patient will re-inhale his own carbon dioxide. If the patient re-inhales his own carbon dioxide, what will happen? If I re-inhale my own carbon dioxide, what will happen to me? My carbon dioxide level increases. I will develop hypercapnia. I will develop hypoxia. My oxygen saturation falls. What are the signs of using exhausted soda lime during anesthesia? If you haven't checked the color, patient will have fall in saturation. Patient will have fall in oxygen saturation. Apart from that, patient is having hypercapnia and acidosis. Due to that acidotic blood, the surgeon complains of what? Surgeon complains that patient is having oozing of blood from the surgical site. Oozing of blood from the surgical site. Patient will be having sweating, patient will be having tachycardia. These are the signs of using exhausted soda lime during operation. What are the signs guys? Fall in saturation, oozing of blood, sweating, tachycardia could be seen. Once you see all these signs, check the color, you will see an exhausted soda lime, change the soda lime and the symptoms will be gone, right? Now guys, there is a rule for using soda lime. First rule is the 100 gram rule. 100 gram will absorb how many liters? 23 to 26 liters. The second is what? Whenever you are using soda lime, 3 inhalational agents should be strictly avoided. 3 inhalational agents should be strictly avoided. What 3 inhalational agents are avoided with soda lime? I used to remember CT scan is avoided with soda lime. C is chloroform, T is trilene, and S is sevoflurane. S is sevoflurane. CT scan should be avoided with soda lime. C is chloroform, T is trilene, S is sevoflurane. Never give these 3 agents. Any one of the, remember guys, why they are avoided? If you give chloroform nowadays we are not at all using, so we won't discuss. If you give this agent called as trilene reacts with soda lime, leading to formation of either phosgene or dichloroacetylene. If phosgene is being formed, the patient lands up into a condition called as ARDS. Due to phosgene formation, the patient lands up into what? ARDS. What is ARDS? Acute respiratory distress syndrome, right? So remember guys, what are avoided with soda lime? CT scan, chloroform we are not using. Trilene if you give, what will happen? It will cause ARDS. If you use sevoflurane goes with soda lime, reacts with soda lime to form a nephrotoxic compound called as what? Compound A or olefin. We have discussed in sevoflurane guys. Compound A or olefin, which is a nephrotoxic compound. So remember, whenever you are using soda lime, three agents are strictly and highly contraindicated. What are the three agents which are contraindicated? CT scan. C is chloroform, T is trilene, and S is sevoflurane, right? So if soda lime is not there, if you don't have soda lime available, the next absorbing material that could be used in the patient is what guys? It could be Baralyme. It could be Baralyme. Baralyme is made up of what? Baralyme is 80% calcium and 20% barium hydroxide. 20% barium hydroxide. Now remember, the most common absorbing material is soda lime only. But Baralyme is the second most common absorbing carbon dioxide material. Okay? Most common carbon dioxide absorbing material is soda lime. Second most common is Baralyme. One rule that we follow with Baralyme uses, never use three agents with Baralyme also. The three agents with soda lime which we never use with CT scan. The three agents that were never used with Baralyme is, if you use that three agents with Baralyme, patient will die. Patient will die. Spelling of die, D-I-E. What are the three agents which are never used with Baralyme? D stands for desflurane. I stands for isoflurane. And E stands for enflurane. What are the agents which are totally or highly avoided with Baralyme? Dye agents are avoided. What are the dye agents guys? Desflurane, isoflurane and enflurane. If you use three agents with Baralyme, they will react, these three agents will react with Baralyme to form a poisonous gas called as carbon monoxide. They can produce carbon monoxide and the patient might die due to inhalation of carbon monoxide. So remember guys, with Baralyme, dye agents are avoided. Desflurane, isoflurane and enflurane. Why? Why? Because they react with this Baralyme to form a toxic gas called as carbon monoxide that can cause what? That can cause death of the patient. So remember guys, this was regarding the breathing circuits and this was regarding the anesthesia machine breathing circuits. Okay, thank you guys.